All right, today we're going to be talking a little bit about the relationship between breast reduction surgery and breast lift surgery. People often ask, am I going to get a breast lift when I get a breast reduction? And the answer to that is absolutely. Breast reduction and a breast lift surgery are very similar type surgeries, with the primary difference between the two being that in a breast reduction surgery, we take away tissue with the intention of making someone smaller, and in a breast lift or mastopexy surgery, we often do just a breast lift and try to preserve all of the volume that is present already. In other words, we try to lift the breast and get more volume under less skin in order to make a tighter, perkier breast. So first we want to talk a little bit about breast reduction surgery. Breast reduction surgery starts with a plan that keeps the nipple and areola attached to a large portion of the breast so that it remains viable and gets good blood flow both during and after the operation. We keep generally the inferior and central portion of the nipple and areola attached to the chest wall, and then isolate that from the remaining portion of the breast. We can remove sections of the breast, primarily in the medial and lateral parts of the breast, and then separate the pedicle, which is the attachment point, from the remaining portion of the breast, and therefore we can elevate that part into the middle and superior portion of the breast. We create an incision pattern in the superior portion of the breast that allows us to elevate the skin and then pull that skin around the new attachment point and elevate the breast as shown in this diagram. When we do mastopexy surgery, we essentially accomplish the same thing that we do during a reduction, but our goal is not to remove any breast tissue. Primarily, we outline the nipple and areola and keep that attached to the breast, and then take skin, primarily in the inferior aspect of the breast, and remove it. We then make an incision pattern, much like we do in a breast reduction surgery, in the superior portion of the breast, and elevate that skin and tissue from the breast so that we can take the lower portion of the breast and push it up underneath the skin that we have elevated. We bring the tissues and the skin around much in the same manner that we do in a breast reduction surgery, and then we end up with a similar incision pattern as shown in this diagram. So as you can see in both of these procedures, our goal is to elevate the position of the nipple and areola on the breast. Our guideline is to try to get the nipple and areola about equal to the height of the crease behind the breast, the so-called inframammary fold. In a breast reduction surgery, we end up removing tissue, primarily from the medial and lateral aspects of the breast, where in a mastopexy or breast lift surgery, we end up removing primarily skin. Occasionally, we can have a hybrid where we remove some breast tissue and some skin in order to make someone just a little bit smaller, but not enough to qualify for a breast reduction. In the end, the incision pattern is the same, and as you can see, a breast reduction also results in a breast lift. Thank you. I'm Dr. Richard Bene, and if you have any questions about this procedure or would like to visit about it, feel free to contact our office and schedule an appointment.